Hello, everyone. It's now 2:00 p.m. Eastern Time, and you've joined the 2024 Justice and Mental Health Collaboration Program Solicitation webinar. So to allow for additional sign-ins past the hour, we will be starting the webinar in just a couple of minutes. So welcome, and please hold on.
Allison.
Yes. Let me restart. Good afternoon, everyone, and thank you for joining today's 2024 Justice and Mental Health Collaboration Program Solicitation webinar. My name is Allison Upton, and I'm a Deputy Program Director at the Council of State Governments Justice Center. I'll be facilitating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance, or BJA. Next slide. And I'd like to introduce you to our panelists today. So to begin with, we are joined by Dr. Brooke Mount, who is a seasoned professional with a wealth of experience in the fields of behavioral health and criminal justice matters. Currently, she holds the position of Senior Policy Advisor within the Justice and Behavioral Health Policy Team at the U.S. Department of Justice's Bureau of Justice Assistance, or BJA. She oversees the Justice and Mental Health portfolio, which includes the Justice and Mental Health Collaboration Program, JMHCP for short, and the Connect and Protect Law Enforcement Behavioral Health Response Program. She collaborates with national partners to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health population, and to create policy and programming that meets the needs of municipalities and the citizens they serve. Dr. Mount is a recognized subject matter expert who holds licensure as a licensed professional counselor in the District of Columbia. Before joining the Bureau of Justice Assistance, she dedicated a decade of her career to the Court Services and Offender Supervision Agency and as the clinical director of a distinguished private psychology practice, providing court-ordered forensic evaluations and specialized counseling services. We're also joined by Ms. Nikisha Love, who is a state policy advisor in the JMHCP program. She has been with the Department of Justice Office of Justice Program since 2008 and is a grants management specialist at BJA. In this role, Ms. Love manages and provides guidance in the administration of the JMHCP grant funding, Adult Drug Court grant funding, and Justice Assistance Grant, or JAG, grant funding. Ms. Love has a strong financial background and has been managing formula and discretionary grant programs for over 20 years. She first started administering grants with the Department of Health and Human Services in the Office of Grants Management as a grants management specialist, where she managed over 300 grants for the Office of Community Services and served as a lead specialist for the Assets for Individual Development Accounts grant-funded program and for the Compassion Capital Fund grants. A big welcome also to Ms. Tammy Lovell, who's also a state policy advisor. She's been with the Department of Justice Office of Justice Program since 2020. She's a grants management specialist for BJA, and in this role, she manages and provides guidance in the administration of the JMHCP grant funding, for collaborative crisis response and intervention grant funding, and for JAG grant funding. Justice for All Effective Administration of Criminal Justice Training and Technical Assistance Grant Funding, and Coronavirus Emergency Supplement Funding. Ms. Lovell has been managing formula and discretionary grant programs for over 16 years. She first started administering grants for Maryland's state administrative agency with the Governor's Office of Crime Prevention, Youth, and Victim Services as a grant specialist, where she managed over 150 grants for the state of Maryland and served as the Senior Law Enforcement Program Manager. We'd also like to welcome Ms. Asia Pappas. Ms. Pappas received her Bachelor of Arts degree in psychology and a Master of Science in Criminal Justice Administration from Chaminade University in Honolulu. She is a licensed Virginia qualified mental health provider, certified crisis intervention team instructor, and a SAMHSA trauma-informed responses trainer. Ms. Pappas has a diverse work history, including serving as a Virginia magistrate, criminal justice trainer, and mental health and substance use provider. She is a veteran of the U.S. Army and currently serves as a BJA supervisor for grants management specialists and a program division chief. Next, Mark Slater is also serving as a grants management specialist for the Bureau of Justice Assistance. In this role, he will manage and provide guidance in the administration of the JMHCP grant funding and Connect to Protect law enforcement and behavioral health grant funding. Prior to joining BJA, Mr. Slater spent 13 years with the local Behavioral Health Authority of Baltimore City and led a team that managed a portfolio of grant funding supporting a variety of behavioral health services throughout the city. He has extensive experience in developing and managing criminal justice and behavioral health collaboration projects, including crisis intervention training, law enforcement assisted diversion, also known as LEAD, co-responder teams, and 911 diversion. Mr. Slater also has over 10 years of direct experience in the behavioral health field in a variety of settings, including assertive community treatment, case management, and outpatient mental health services. And we also want to welcome Sarah Wurtzberg, who's a Deputy Division Director for Behavioral Health at the Council of State Government Justice Center. In this role, she oversees technical assistance focused on behavioral health, diversion, and reentry, and serves as the lead for projects related to substance use, mental illnesses, and housing through her oversight of the JMHCP and Second Chance Act federal training and technical assistance portfolio. She leads the work on the development of community responder programs, including a toolkit that supports sites in development of expanding first response options to people in crisis. Previously, Ms. Wurtzberg was a research analyst at the National Association of State Alcohol and Drug Abuse Directors and also worked as a juvenile court advocate and in community substance use disorder prevention. So I want to really thank all of our panelists and presenters for joining us today. We're really looking forward to learning more about this new funding opportunity. Next slide. So to give you a sense of today's webinar, first we'll have a brief overview of the Justice and Mental Health Collaboration Program, or JMHCP. And after that, we will discuss the award information, budget, application criteria, followed by the submission requirements and application resources. And finally, towards the end of the webinar, we will have time for questions and answers. And anytime during this webinar, you can ask a question. Just a little bit of housekeeping by clicking on the Q&A button at the bottom of your screen and entering your question. This includes both technical and content-related questions. We will try to reply to the technical questions in the chat window as we go. And for the content-related questions, we may reply to some, but we will also keep a running list and address them at the end of the webinar. And we'll do our best to get through as many questions as possible. If you encounter any technical or audio problems during the webinar, please click on the links that are dropped in the chat box, and we will try our best to assist you on that. Please understand that there are some technical issues we may not be able to resolve, but we are recording this webinar and we will post it onto our website by the end of next week. And now I will turn it over to Brooke to tell us more about the Bureau of Justice Assistance and the Office of Justice Programs. Brooke?
Thank you so much, Allison. Can you please go to the next slide? Well, first of all, I just want to thank everyone who is in attendance today for the Justice and Mental Health Collaboration Program Solicitation webinar. We are so excited to be presenting this incredible program to all of you today. And we hope that we're able to address your questions and really give you a great understanding of what this program is all about. I wanted to start off by just telling you guys a little bit about the Bureau of Justice Assistance, or BJA. We're located within the Office of Justice Programs, or as you may know it, OJP. And OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. And OJP is actually just one of 3 grant-making components of the Department of Justice, along with the Office on Violence Against Women and the Office of Community-Oriented Policing Services. Next slide, please. This year, we are proud at BJA to be celebrating our 40th anniversary. We were created in 1984 to reduce violent crime, create safer communities, and reform our nation's criminal justice system. BJA focuses its programmatic and policy efforts on providing a wide range of resources, including training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, and community-based partners. Next slide, please. Our work really focuses on providing funding through programs like JMHCP, transferring knowledge through training and technical assistance, and developing guidance and resources and engaging with partners and stakeholders all across the country. Next slide, please. Grantee teams who receive Justice and Mental Health Collaboration Program awards will be supported throughout the active grant lifecycle by the BJA Policy and Programs Office, as well as the Council of State Governments, or CSG, Justice Centers Technical Assistance Providers. I'm now going to turn it back over to Allison, who's going to tell you a little bit more about CSG.
Thanks, Brooke. So just a little bit of brief background on the Council of State Governments Justice Center, or CSG Justice Center for short. The Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all 3 branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. And as Brooke mentioned, we are currently the training and technical assistance provider to active Justice and Mental Health Collaboration Program grantees. Next slide. So this slide just shows a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. Next, we have like a quick polling question that we'd love to ask you all. We'd really like to get a sense of your experience with federal grants. So please take a moment to respond to the poll that you're seeing on your screen. All right, we're getting a lot of numbers in. Thank you for your responses. Keep them coming. Okay. Looks like we're getting pretty much to a critical mass here. Wow. So nearly half of the attendees today, 48% has had prior extensive experience with federal grants. And even an additional almost 30% has had some, experience. So we have a lot of, prior grantees or agencies that are, or people that are aware of the federal funds, including the ones funded through Department of Justice. And we have some maybe folks who are here to learn more, which is fantastic. I want to assure you that all are welcome, and we really hope that you ask a lot of questions today, and we're glad that you're here to learn more about this funding opportunity. And now I will turn it over to Brooke to talk in more detail about the JMHCP program.
Thank you, Allison. If you don't mind going to the next slide, please. Thank you. All right, everyone. Well, let's go ahead and get started and talk about JMHCP. OJP is committed to advancing work that promotes civil rights and equity, increasing access to justice, support crime victims and individuals impacted by the justice system.
Hello, everyone. We may be having some technical issues here. So Brooke, I'm not sure if you can hear us or not, but oh, here we go. I think Brooke is going to connect again. Great.
Yeah, I apologize.
No,
My
it's okay.
computer is dropping off of Zoom. This is the second time during this presentation.
Wow.
So I apologize if it happens again. I will have to probably reset my system.
Brooke, you may also be able to call in on your cell phone as a backup, but
Thank
okay.
you.
Yeah.
Well, let's hope it does not happen again. All right. So as I was saying, OJP is committed to advancing work that promotes civil rights and equity, increasing access to justice, supporting crime victims and individuals impacted by the justice system. With this particular solicitation, we're seeking applications for funding programs that support cross-system collaboration to improve public safety responses and outcomes for individuals with mental health disorders or co-occurring mental health and substance use disorders. BJA provides grant funding to help organizations prepare, create, or expand comprehensive plans and then implement these collaborative projects to target people who qualify. This program furthers the Department of Justice's mission to uphold the rule of law, to keep our country safe, and to protect civil rights. BJA is seeking applications for funding programs that support cross-system collaboration to improve public safety responses and outcomes for individuals with mental health disorders or co-occurring mental health and substance use disorders. BJA provides grant funding to help organizations prepare, create, or expand comprehensive plans and then implement these collaborative projects to target people who qualify. This program furthers the mission to uphold civil rights and keep our country safe. Next slide, please. This year, we have our JMHCP funding divided into two different categories. Category 1 is the criminal justice system collaboration, which includes pretrial, prosecution, courts, and behavioral health. And Category 2 is comprised of jails and prisons, probation and parole, and behavioral health. Next slide, please. We are estimating to make up to 13 awards within our JMHCP funding Category 1, with a maximum award amount of up to $550,000 for each award. And our period of performance is 36 months, with a performance start date of October 1st, 2024. Next slide, please. In our Category 2, we're looking to make up to 12 awards of up to $550,000, with also a period of performance of 36 months starting on October 1st, 2024 as well. Next slide, please. For the purposes of this solicitation, JMHCP will do the following. We want to focus on pretrial, prosecution, courts, probation, and parole this year. We want to address the needs directly related to the criminal activity of adults with mental health conditions, living in homelessness or marginalized communities with minimal access to treatment, needing wraparound services in the criminal justice system, and leaving incarceration. Next slide, please. BJA will only accept applications that demonstrate the proposed program will be administered jointly by an agency with responsibility for criminal justice activities and a mental health agency. JMHCP is authorized by legislation to be a cross-system collaboration. Well, what is a cross-system collaboration? And these are applications that are between a justice entity and a behavioral health or mental health entity. And we will only consider applications that are jointly administered as a cross-system collaboration. So applicants must enter a partnership between those two justice and mental health entities. A mental health entity is defined as an agency of the state or local government or its contracted agency that's responsible for mental health services or co-occurring mental health and substance use services. A criminal justice entity is an agency or state or local government or its contracted agency that is responsible for the detection, arrest, enforcement, prosecution, defense, adjudication, incarceration, probation, or parole relating to the violation of criminal law. Next slide, please. JMHCP specifically funds collaborative programs to reduce criminal justice involvement by improving outcomes for individuals with mental health disorders or mental health substance use disorders who come into contact with the criminal justice system or are leaving a custodial setting. Per the authorizing statute, JMHCP requires a two-phase process consisting of planning and then implementation activities, during which grantees will develop a coordinated approach to implementing or enhancing services. Applicants must submit one application that proposes detailed activities for both a planning phase and an implementation phase. And we will be getting into more detail soon about that in a future slide. Next slide, please. So JMHCP does support a very wide array of activities, and this is not intended to be an exhaustive list, but really to just provide some examples. But some program activities that can be funded by JMHCP include connecting individuals who have mental health disorders or mental health and substance use disorders with treatment and social services through support for the 988 Suicide and Crisis Lifeline, connecting individuals who have mental health disorders or mental health substance use disorders with programs and services, including case management, crisis stabilization units, and pre-arrest diversion. It can also be used for creating or expanding mental health courts or other court-based approaches to preliminarily qualified individuals, and also increasing prosecutor or defense-led diversion strategies. Next slide, please. Creating connections and entities and or providing supported employment services for people with behavioral health conditions are another example of program activities, in addition to utilizing specialized caseloads for probation, employing cross-system training of public safety officials and mental health providers, and increasing intergovernmental cooperation between state and local governments to support individuals with mental health disorders or mental health and substance use disorders. Next slide, please. So as I've mentioned, and I will continuously mention throughout today's webinar, the goal of JMHCP is to improve outcomes for adults with mental health disorders, co-occurring mental health and substance use disorders, and people with intellectual and developmental disabilities who come into contact with the criminal justice system. And BJA intends to make site-based awards for grantees to pursue the following objectives. And these do apply to both Category 1 and Category 2. To enhance, expand, and operate mental health drop-off crisis stabilization treatment centers, increase the community's workforce capacity for certified mental health peer support specialists and wraparound services, build or expand capacity to identify, treat, and support the recovery of individuals at the intersection of justice and mental health, as well as increase policy and programmatic strategies to improve access for care, or even build or expand upon existing justice and mental health collaboration programs. JMHCP supports grants to help eligible entities plan, implement, or expand comprehensive collaboration programs to improve public safety and public health for preliminarily qualified individuals with mental health disorders, including people with traumatic brain injury and post-traumatic stress disorder, or mental health and substance use disorders who come into contact with the criminal justice system. The term preliminarily qualified offender is defined in the 21st Century Cures Act, and we will include the link in the chat. I also want to note that the link is provided in the solicitation, so please make sure that you are able to read in the entirety what qualifies as a qualified offender, but I wanted to explain in general, it means an adult accused of an offense who previously or currently has been diagnosed by a qualified mental health professional as having a mental illness or co-occurring mental illness and substance abuse disorder, who manifests obvious signs of mental illness or co-occurring mental illness and substance use disorders during their arrest or confinement or before any court, and has been unanimously approved for participation in the program funded under this section by a relevant prosecuting attorney, defense attorney, probation or corrections official, judge, a representative from a mental health agency. The adult must not pose a risk of violence to any person in the program or the public if selected to participate in the program, and cannot have been charged with or convicted of any sex offense or any offense relating to the sexual exploitation of children or murder or assault with intent to commit murder. Next slide, please. So category 1 objectives include developing or expanding existing justice and mental health collaboration programs to support court navigators, case managers, and court liaisons, use peer support advisors in court settings, increase resources for strengthening courts, increase behavioral health and trauma-informed training for judges and court staff, and to support equity across the courts by examining data. Next slide, please. In addition, some other objectives include to promote diverse court-based strategies such as deflection and diversion to treatment from the criminal justice system, planning to participate in the propelling change of prosecutors' call to action and commit to completing the outlined steps within that national initiative, and to establish state-level multidisciplinary task forces to promote systemic changes necessary to improve the courts and community responses to mental illness. We also provide funding and resources for competency to stand trial and competency restoration, as well as appropriate diversion and outpatient restoration resources. JMHCP funding can also be used to develop case management practices and lead to the support and identification of appropriate data, as well as data collection and information sharing opportunities across the community. Next slide. Now, category 2 specific objectives are really focused on increasing supportive approaches in community crisis care, such as crisis response centers, mobile crisis teams, and supportive supervision as crisis calls increase to the 988 Suicide and Crisis Lifeline, requiring increased community resources and care. Objectives of category 2 also include the implementation of specialized caseloads as a tool for reducing recidivism, developing specialized supervision case plan,
Taking me out of the meeting.
developing an infrastructure by providing ongoing training for probation, parole, and staff and behavioral health partners, and connecting people with mental health and co-occurring substance use disorders to treatment and community supports. Next slide. Additional objectives include establishing ways to capture data to improve program sustainability, embedding behavioral health professionals within the community supervision offices to enhance resource linkage, build positive community relations and trust through increased outreach, and seek and deploy best practice training, such as management of withdrawal for individuals with substance use disorders, psychopharmacotherapy in detention, correctional settings, and working with individuals, behavioral health conditions, and disabilities. As you can see, there are just a wide range of use of funding across the span of category 1 and category 2. Next slide, please. Per the authorizing statute, JMHCP requires a two-phase process consisting of planning and then implementation activities, during which grantees will develop a coordinated approach to implementing or enhancing services for individuals with mental health disorders or mental health disorders for people who come into contact with the criminal justice system. Applicants must submit one application that proposes detailed activities for both a planning and implementation phase. During the first year, grant recipients will receive intensive training and technical assistance, or TTA, from the Council of State Governments Justice Center to develop this planning and implementation guide. The planning phase will be up to 12 months, during which the recipient will only have access to the first $100,000 of the award funds for completion of this phase. The implementation phase will begin once the grantee has met the requirements of the planning phase to include the recipient's completion and BJA's approval of the required P&I guide, and then it will continue for the remaining time of the grant. Applicants must also demonstrate that at least one criminal justice agency and one mental health agency will participate in the administration of the program through established roles and responsibilities described in an attached Memorandum of Understanding, or MOU, which will be described in more detail coming up soon. Next slide, please. Under JMHCP, other expected deliverables of grantees will include developing a detailed implementation plan that follows the format provided by BJA's training and technical assistance provider and aligns with the objectives listed previously. We also expect that you create a public-facing report that includes information on the program's available resources to support community education and advocacy, describe how demographic data were used to target a diverse population, and include both qualitative and quantitative information such as efficiencies and challenges that will increase access and inclusion and the number of people leaving the justice system who are successfully connected to services. We also ask that you incorporate training and technical assistance information and best practice guidance, which will be delivered by BJA's training and technical assistance provider, into the program planning and implementation guide. And finally, we ask that you submit a sustainability plan prior to the closeout of the program. You must include a description of the process for obtaining the necessary support to sustain and continue the proposed collaboration program following the conclusion of the support. Next slide, please. To further OJP's mission, OJP will provide priority consideration when making award decisions to the following. Priority 1A includes applications that propose projects that are designed to meaningfully advance equity and remove barriers to accessing services and opportunities for communities that have been historically underserved, marginalized, adversely affected by inequality, and disproportionately impacted by crime, violence, and victimization. To receive this consideration, the applicant must describe how the proposed project will address identified inequities and contribute to greater success to services and opportunities for communities that have been underserved, marginalized, adversely affected, and disproportionately impacted by crime, violence, and victimization. Project activities under this consideration may include, but are not limited to, the following: improving victim services, justice responses, prevention initiatives, reentry services, and other parts of an organization's or community's efforts to advance public safety. Applicants should propose activities that address the cultural and linguistic, if appropriate, needs of communities, outline how the proposed activities will be informed by these communities, and implement culturally responsive and inclusive outreach and engagement. Next slide, please. Priority 1B applicants need to demonstrate that their capabilities and competencies for implementing their proposed projects are enhanced because they, or at least one proposed subrecipient that will receive at least 40% of the requested award funding, are a population-specific organization that serves communities that have been historically underserved, marginalized, adversely affected by inequality, and disproportionately impacted by crime, violence, and victimization. For purposes of this solicitation, population-specific organizations are nonprofit, non-governmental, or tribal organizations that primarily serve members of a specific underserved population that have demonstrated experience and expertise providing targeted services to members of that specific underserved population. To receive this additional priority consideration, applicants must describe how being a population-specific organization or funding the population-specific subrecipient organizations will enhance their ability to implement the proposed projects and should also specify which historically underserved populations are intended or expected to be served or have their needs addressed under the proposed projects. Next slide, please. In addition to executing any OJP priority areas listed previously, additional programmatic priority areas for consideration include promoting effective strategies for the identification and treatment of females with mental health disorders who are involved in the criminal justice system, as well as promoting effective strategies to expand the use of mental health courts and related services, and propose interventions that have been shown by empirical evidence to reduce recidivism. Next slide, please. In addition, programmatic priority areas also include, when appropriate, the use of validated assessment tools to identify and prioritize individuals with a moderate to high risk for recidivism and need for treatment services, demonstrate and ensure that funds are used for public health and public safety, demonstrate active participation of co-applicants in administering the program, document in whole or in part that funds used for treatment of incarcerated populations will provide transition and reentry services for such individuals. Now, please note that addressing these priority areas is one of many factors that OJP considers in making funding decisions. So receiving priority consideration for one or more priority area does not guarantee an award. Now I'm going to pass it over to Tammy Lovell in our programs office, who will start to talk about budget and associated documentation.
Thank you, Brooke. Welcome, everyone. So as Brooke stated, I'm going to talk a little bit about the budget and associated documentation. Applicants should structure their budgets to allocate up to $100,000 to complete the planning phase within the first 12 months of receiving the final OJP approval of the program's budget. The applicant will need to clearly identify which budget line items are in planning costs. Although applicants will be required to submit a budget for the entire 36-month program at the time of application submission, they also may revise their budgets based on any outcomes resulting from the planning phase. Next slide. We're going to talk a little bit about data collection now. Plan for collecting data required for the solicitation's performance measurements. Description of the process for the measuring project performance. Identify who's going to collect the data, who is responsible for performance measurement, and how the information will be used to guide and evaluate the project's impact. And finally, describe the process to accurately report data. I also wanted to note that there was going to be a website link dropped in the chat that applicants can use for OJP's goals and objectives for this specific program. That is very useful. Next slide. And we should also note that applicants are not required to submit performance measurement data with the application. Rather, the performance measure information is included to provide notice that the award recipients will be required to submit performance data as part of each award's reporting requirements. Next slide. We're going to talk a little bit about the match requirement for this award. This funding opportunity requires an escalating match, cash or in kind. Match means the portion of project costs not paid by federal funds or contributions unless otherwise authorized by federal statute. For years 1 and 2 of this award, it is a 20% match requirement. For year 3, it escalates to 40%. Federal funds awarded under this funding opportunity may not cover more than 80% of years 1 and 2 and not more than 60% for year 3 of the total cost of being funded. An applicant must identify the source of the 20% and 40% non-federal match portion of the total project costs and how they intend to use those funds. If an award recipient's proposed match exceeds the required match amount according to the formula below, OJP approves the budget. The total match amount is then approved and becomes part of the project budget and is subject to audit. Match funds may be used only for the purposes that would be allowable for the federal funds. This means that neither federal funds or matching funds may be used for costs considered inappropriate by the awarding agency, such as land acquisitions, fundraising, or lobbying. Next slide. And as far as a match waiver, the grant-making component will waive any requirement of match funding, including in-kind, under $200,000 for all awards made to American Samoa, Guam, the U.S. Virgin Islands, Northern Mariana Islands, unless otherwise required by law to be provided, and may waive any requirement for matching funds equal to or over $200,000 for all awards made to those territories or to the trust territory of the Pacific Islands. The $200,000 amount is determined on a grant-by-grant basis, not to be aggregate total of all matching requirements applicable to an insular area regarding, and I would refer you to the code that is listed in the slide. Now I'm going to briefly hand it back over to Brooke.
Thank you so much, Tammy. We're going to talk about the eligibility and application requirements next. Next slide, please. Thank you. Eligible applicants of JMHCP include state governments, special district governments, city or township governments, public and state-controlled institutions of higher education, county governments, Native American tribal governments that are federally recognized, and agencies with a different legal status to include nonprofit or for-profit mental health agencies who are eligible to apply only if they meet the following 2 requirements. 1, the applicant is designated by the state mental health authority to provide services as a unit of the state or local government. And 2, the applicant must attach documentation to support this designation. BJA will consider applications under which 2 or more entities or project partners would carry out the federal award. However, only one entity may be the applicant for the solicitation. Any others must be proposed as sub-recipients or sub-grantees. Next slide, please. So an application should include the following: an SF-424 and SF-LLL, which is located in grants.gov, a proposal abstract, which is to be uploaded in Just Grants, a proposal narrative to be included in Just Grants, a budget web-based form, which includes the budget details and the budget narrative in Just Grants, financial management and system of internal controls questionnaire, including applicant disclosure of high-risk status in Just Grants, and the MOU between a criminal justice agency and a mental health agency to demonstrate that partner. Again, those entities applying as other category must attach documentation to support their designation as a state or local government provider. The applicant will submit the goals, objectives, deliverables, and timeline in the Just Grants web-based form. This is a summary of the goals, objectives, deliverables, and timeline that relate to the proposal narrative. And the applicant will also enter the projected fiscal year and quarter that each objective and deliverable will be completed. Next slide, please. Now, we do tend to get a lot of questions regarding the Memorandum of Understanding, and I definitely want to take some time to cover that now. Applicants must submit for applications submitted from 2 or more entities, applicants are encouraged to develop and submit a signed MOU or a signed letter of intent. But this is also required at the time of application to demonstrate that collaborative partnership between the criminal justice entity as well as the mental health entity. Applicants should include for each named partner the signed MOU or letter of intent, or a subcontract that confirms the partner's agreement to support the project through the commitments of time, staff, space, services, or other project needs. For applications submitted from 2 or more entities, applicants are encouraged to develop and submit signed MOUs or signed letters of intent that provide a detailed description of how the agencies will actually work together to meet their project requirements. And please note that each MOU or letter of intent should include the following components. 1, the names of the organizations involved in the agreement. 2, what services and other work will be performed under the agreement and by what organization. And 3, the duration of the agreement. Next slide, please. Applications that meet basic minimum requirements will be evaluated by peer reviewers on how the proposed project and program addresses the following criteria. The description of issue is to evaluate the applicant's understanding of the program and the issue being addressed. The project design and implementation is to evaluate the strength of the proposal, including information provided in the goals, objectives, timelines, and deliverables web-based form. Capabilities and competencies evaluate the applicant's administrative and technical capacity to successfully accomplish the goals and objectives. The plan for collecting the data required for the solicitation's performance measures evaluate the applicant's understanding of the performance data reporting requirements and the plan for collecting the required data. And the budget evaluates for completeness, cost effectiveness, and allowability. Other important considerations for OJP include geographic diversity, strategic priorities, specific including but not limited to those priority areas already mentioned, if applicable, available funding, past performance, and the extent to which the budget web-based form accurately explains project costs that are reasonable, necessary, and otherwise allowable under federal law and applicable federal cost principles. Costs are allowed when they are reasonable, allocable to, and necessary for the performance of the federal award, and when they comply with the funding statute and agency requirements to include the conditions of the award, including the cost principles set out in the proposal. Next slide, please. Now, before submitting an application, all applicants must register with the System for Award Management, or SAM.gov. An applicant must renew their registration every 12 months. If an applicant does not renew their SAM.gov registration, it will expire, and an expired registration can delay or prevent application submission in grants.gov and Just Grants. Applicants are encouraged to start the SAM.gov registration process at least 30 days prior to the application deadlines. Applicants who fail to begin the registration or renewal process at least 10 business days prior to the grants.gov deadline may not complete the process in time and will not be considered for late submission. Applications must be submitted to the Department of Justice electronically through a 2-step process that begins in Just Grants and then that begins in grants.gov and is completed in Just Grants. The first step is after registering with SAM.gov, the applicant must submit the SF-424 and SF-LLL in grants.gov at https://grants.gov/register by the deadline. To leave time to address any technical issues that may arise, an applicant should submit these forms as early as possible and recommended not later than 48 hours before the grants.gov deadline. Again, if an applicant fails to submit in grants.gov by the deadline, they will be unable to apply in Just Grants. Applicants can confirm grants.gov submission by verifying their application status shows as submitted or agency tracking number assigned. Step 2. The applicant must then submit the full application, including attachments, in Just Grants at justgrants.usdoj.gov by the Just Grants deadline. OJP recommends that all applicants submit the completed application package in Just Grants at least 48 hours prior to the Just Grants deadline. Some of the required sections of the application will be entered directly into Just Grants, and other sections will require documents to be uploaded and attached. Therefore, applicants should allow enough time before the Just Grants deadline to prepare all of the requirements of the application. Applicants may save their progress in the system and add to it or even change the application as needed prior to hitting the submit button at the end of the application in Just Grants. An applicant will receive emails when successfully submitting in grants.gov and Just Grants, and should maintain all emails and other confirmations received from SAM.gov, grants.gov, and Just Grants systems. Next slide, please. Now, please take note of the submission dates and timeframes. OJP recommends that applicants submit their completed application package in Just Grants, as mentioned, at least 48 hours prior to the Just Grants deadline, which is on May 14th, 2024. The grants.gov deadline is a few days prior on May 9th, 2024. OJP will only consider requests to submit an application after the deadline when the applicant can document that a technical issue with a government system prevented submission of the application on time. If an applicant misses a deadline due to unforeseen technical issues with SAM.gov, grants.gov, or Just Grants, the applicant may request a waiver to submit an application after the deadline. However, the waiver request will not be considered unless it includes documentation of attempts to receive technical assistance to resolve the issue prior to the deadline. A tracking number is the most typical documentation and is generated when the applicant contacts the applicable service desks to report technical difficulties. Tracking numbers are generated automatically when an applicant emails the applicable service desk, and for this reason, long call wait times for support do not relieve the applicant of the responsibility of getting a tracking number. OJP will review each waiver request and the required supporting documentation and notify the applicant whether the request for late submission has been approved or denied. An applicant that does not provide documentation of a technical issue, including all of the information listed above, or that does not submit a waiver request within the required time period, will be denied. For more information on the waiver process, OJP encourages applicants to review the Experiencing Unforeseen Technical Issues section in our application resource guide. I will now pass it over to our programs office, who will spend some time discussing some wonderful resources that may be of assistance to you.
Thank you, Brooke. Now we're going to talk about some valuable resources to help you with your application submission. Next slide. So I just wanted to point out the OJP Grant Application Resource Guide. This is an extensive guide that offers all sorts of information from how to apply through grants.gov and Just Grants. all the way down through each specific portion of your application, such as your disclosure of lobbying activities, your abstract, the different areas of the budget, different application attachments, financial information, application review information. So I strongly encourage you to visit the links that are in this slide, as they offer a wealth of information regarding your application. Next slide. And I also wanted to point out, on the Just Grants website, OJP's website, you can learn about the Just Grants and system and payment management systems. And this also offers any kind of up-to-date news with BJA, virtual training sessions, question and answer sessions. You can also access the frequently asked questions regarding Just Grants. It gives you information about logging in, different trainings that we offer, any kind of frequently asked questions regarding Just Grants or programs that we have. Here's a link on the page for user support using Just Grants, and then any kind of news and updates, as well as a link for additional resources. Next slide. And again, with your application assistance, as Brooke was mentioning, there are two systems that you will need to be submitting through. The first is grants.gov. You can see the customer service hotline if you have any kind of issues supporting your SF424 or your SFLLL. You can contact the numbers below. They are open 24 hours, 7 days a week, except on federal holidays. And also included on the slide is a web link and their direct email. And they provide information on available federal funding opportunities for various federal agencies. And then the second the second system that you're going to be submitting in is the Just Grants. And their technical support information is listed here on the line, 833-872-5175. And they are open Monday through Friday, 7 a.m. to 9 p.m. Eastern time. And they also have Saturday hours and federal holidays, 9 a.m. to 5 p.m. And their website link and email is also listed on this slide. Next slide. And as far as we wanted to also offer this slide, this is a snapshot from OJP's website. This is a Stay Connected slide that offers a link to OJP's news releases, information that gets emailed, a newsletter, Just Info that is emailed out twice a month. We have funding news, which is a weekly notification to new grant opportunities and application tips. We also have an updated newsletter for the latest information and updates on Just Grants and DOJ's grants management system. And then finally, we also have an OJP email newsletter, which offers topical messages available from OJP programs offices such as BJA, BJS, NIJ, OJJDP, OVC, and SMART programs. And you can sign up for these at the U.S. Department of Justice email updates in the link provided on the slide. Next slide. As additionally, staying connected, we are on Facebook, Twitter, and YouTube. And to make things easier, we have issued put a QR code in there to subscribe to Justice Matters and News from BJA, in which you will receive the latest information from BJA and the field. For information on funding opportunities, publications, and initiatives, please be sure to visit BJA's website at www.bja.ojp.gov. Next slide. And finally, we want to offer you some information on OJP's Response Center. Their email is listed on the slide. It is grants@ncjrs.gov. Their toll-free number is 800-851-3420. And their hours of operation are Monday through Friday, 10 a.m. to 6 p.m. Eastern Time. I'm going to hand it back over to Allison now.
Great, thank you so much, Tammy and Brooke. We really appreciate all of your presentation and information today on this funding opportunity. Next slide. Oh, there are some important contacts here. And we also want to remind you about the dual on the slide before, about the dual deadlines. This is all included in the solicitation directly. Next slide. And one more slide. Great, so now we're going to begin the question and answer portion of the webinar. So we are going to respond to as many questions as we can. It's good we have time remaining. And as a reminder, if you haven't already done so, feel free to ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. And we're going to try to get to as many questions as possible. Another reminder, this webinar has been recorded and it will be posted along with this slide deck. So you'll have all of the resources that were at the end included. It's going to be posted in about a week on the CSG Justice Center's website. So maybe we can put that in the chat as well. And so we'll start with some questions. I want to first say, this is really the first year that we had the opportunity to include an opportunity for the field to ask questions in advance. So we thank you to those who submitted questions in advance of this webinar today. We received a lot of questions, which is great. But in the interest of time, we're going to be answering only some of the advanced questions live today, but we wanted to let everyone know that after this webinar, BJA will send an email response to each person who sent questions in advance. So if you don't hear your question being asked live today, you will get a response. Okay, so the first question I'd like to pose, and I will also, well, I'll find out a way to put it into the chat, but I'll ask it for now so that the audience can hear. So the first question I'd like to ask is, can you please provide a definition or explanation for other, quote, other mental health agencies designated as a state or local government provider?
Yes, absolutely. I'll take that one. On page 4 of the solicitation, we have listed other agencies with a different legal status to include nonprofit or for-profit mental health agencies. And again, you have to demonstrate eligibility by meeting the following 2 requirements: that you are designated by the state mental health authority to provide services as a unit of the state or local government, and you must attach documentation to support that designation.
Great, thank you, Brooke. Okay, we're going to move through the questions because there's a lot of great ones here. Okay, so next question is, the maximum grant award is $550,000 for a total of 3 years and not per year. Is that correct?
Is programs on the line? Well, I will answer that. Yes, the total maximum award amount for the entire period of performance of the award is up to $550,000.
Great, thank you very much. And now we have a couple of questions about match, on the topic of match. So the first is, what happens if we overmatch? And I'll look to programs office probably if you're able to. Oh, great. Thanks, Tammy.
Yes, so I can address that. If you're overmatched, it's fine to be overmatched, but you will be held accountable for that match and you are required to meet it. And it is subject to audit.
Okay, thank you, Tammy. And one more question about match. Can we roll over our match from year to year?
So match can be rolled over, however, give me 1 second. I apologize.
Oh, it's
Just
okay.
lost my, okay. So if a recipient or a subrecipient has included match that excuse me, I apologize. Let me go back to the overmatch question just for 1 second. If the recipient or the subrecipient has included a match that exceeds the required match portion within the approved budget, the records of those additional amounts must be included and maintained as they are part of the regular match amount. And once again, they are subject to audit. Now, as far as can they roll over match from year to year, the match must be met at 20% for years 1 and 2 combined and 40% for year 3. If the total match calculated, that means that the total match calculated must meet the project period, must be met by the project period end date. And I know that's confusing, so if you need me to repeat it, I can.
Okay, well, we'll see if any additional, I put these questions into the chat actually, but we'll see if any additional questions, clarifying questions come up, and we'll let you know. Thank you, Tammy. Okay, next question. Our proposal is spanning both category 1 and category 2, and I actually think there's multiple questions in this topic. So our proposal is spanning both category 1 and category 2. Is there a problem with delivering services in both areas? Oh, Brooke, I think, yeah.
No problem. That is a great question. And I'm actually going to ask Sarah Wurzberg if she can provide a response for that one.
Yeah, absolutely. So it is actually common for programs to work across multiple intercepts, particularly depending on the size of your jurisdiction. So that's definitely allowable. We did receive a couple of questions that asked also if a county could apply for 2 different awards, one in category 1 and category 2. So both are options. You could decide to apply for different awards in different categories. You'd be competing separately for each of those. Or you could apply for select a category that you think is the best fit, and you could work throughout the whole system rather just than in the front end or the back end of the system. So either are viable options that have been successful applicants in the past.
Great, thanks, Sarah. Okay, so next question is, and again, I think I saw a couple of questions in this area. How is adult defined for this solicitation? So what is the age range? And there's also questions about whether youth-related activities can be funded. So I'll kind of ask them all in one shot, I think.
Yeah, thank you so much, Allison. So for the purposes of FY24, we are awarding to adults only. So there is a planned solicitation for FY24 that the Office of Juvenile Justice and Delinquency Prevention, or OJJDP, plans to release. That is the FY24 Youth Justice and Mental Health Collaboration Program solicitation. So I would encourage prospective applicants to review that solicitation once it has been released. And for more information on that specific solicitation and all of our planned solicitations that we are planning on releasing throughout the Department of Justice, you're encouraged to visit our fiscal year 2024 Department of Justice program plan that you can access by going on to ojp.gov.
Great, thanks for that clarification, Brooke. Okay, next question. As a Category 1 mental health court applicant, must I respond to all objectives? For example, I'm not sure if the treatment providers I am partnering with have a 24/7 drop-off crisis stabilization center.
So the objectives that we outlined are just examples of the objectives that we are providing to encourage creativity and response to the program. So you are not expected to be meeting all of those objectives. They are just goals that we have of the program overall.
Great, thank you. Next question. What if the planning phase activities uncover or lead to new ideas not in the original implementation phase? Great question.
I'm going to turn that over to our TTA provider, CSG, for that one.
Well, Sarah might be typing another response. Sarah, feel free to jump in too, but I could say that this happens from time to time. In fact, sometimes when you're planning, that's sometimes the point and the benefit of thorough planning, right? Is you uncover new ideas or new potential challenges, and you want to adjust your implementation in some way. So I think that's something that we work through definitely on our technical assistance calls. You can work through that and brainstorm around that with your technical assistance provider. And in some instances, if it's a particular kind of change or a large enough change, you may need to ask BJA for permission to make that change. And that does happen from time to time. I don't know, Sarah, if you wanted to add anything more, but okay.
Nothing to add. Thanks.
Yeah, okay. Okay, next question. If a mental health or wellness court program that's a diversion program, I think this, well, let me ask it anyway, just for clarification. So someone's asking if they're going to propose a mental health wellness court program as a diversion program, but the case service coordination is going to be done by staff within the probation department. Does that fall in category 1 or category 2?
I'm going to ask Sarah if she's able to provide a response to that one.
Yeah, so I think that's actually similar to the response to the other category. So it's really where you define most of the services for being delivered. So if you're viewing it as a diversion program, it could definitely qualify under category 1. Probation and parole are also, part of the court system, obviously. So in most locations. So I think there's some discretion that you would use in terms of where you think is most appropriate for that application. But based on what you're saying, probably category 1.
Great, thanks, Sarah. Okay, next question, back to a matching, so probably programs office. So can matching funds come from other grant sources? Tammy, are you able to hear us?
Allison,
Oh, Nikisha, yes.
yes. When they're saying other grant sources, I need a little bit more clarification.
Okay, so I believe this, hopefully the guest, the attendee knows who asked this question. It's someone named Gretchen. So if you could please clarify, we'll come back to that.
So Allison, maybe a way to frame that so Nikisha can answer it is, Nikisha, if it's another federal grant versus a non-federal grant funding, if it's a state grant, the answer might be different for that. So if it's a state grant, would that be eligible versus a federal grant?
Again, it would all depend on what those purposes of those funds are being utilized for.
Okay, so we'll see.
I know federal is a no.
Okay.
Yeah, and sorry, I was having technical difficulties. I'll just add on, sorry. I'll just add on to say that we would encourage you to ensure that you're checking with the DOJ financial guide in regards to match requirements. And then, of course, if you are selected for funding, you can reach out to your grant manager because we want to ensure that supplanting is not happening. And there definitely are some different rules when it comes to federal funds versus state funds, local funds, etc.
Great, thanks so much. We'll wait to see if any clarifying information comes in. Thank you, Sarah. The DOJ financial guide posted in the chat. And also, I just want to remind everyone that we'll get to as many questions as we can today. We still have time. But if we do not get to all the questions, please feel free to ask your questions after this webinar at the what address we're going to put into the chat as well. Okay, so moving forward. Another question, we have contracts and letters of intent with partners that they're working with. Is it possible to submit those in place of an MOU to show partnerships with a mental health provider?
So in order to apply, you may successfully include documentation such as a letter of support, to demonstrate this collaboration. However, a finalized memorandum of understanding is a requirement during the first phase of the grant. So that would have to be finalized within that first year in order for the funds to be released.
Great, thank you, Brooke. Next question is, would assisted outpatient treatment be considered as the collaborative effort in a proposal? So I'm thinking they mean the justice system behavioral health collaboration.
Yes, any behavioral health entity would be considered that partner with the criminal justice agency.
I'm not sure, but I think the person means, would that one entity, that one, be considered both partners?
Oh, thank you for that clarification. So unfortunately, no, we would need to demonstrate a collaboration amongst two different entities for this specific grant in order to be eligible to apply. Allison, you are muted.
I thought I unmuted myself. Okay. So next question may need to be with the programs office. Are there limitations in terms of subrecipient agencies who can accept these funds? Or Brooke, are you?
Right. So again, from programs, I'll say that we're going to want to ensure you're looking at that DOJ financial guide, which will talk about subrecipient relationships and then also guide you to the CFR. But what I will say is that any subrecipient relationship, anyone that you plan to have a subrecipient relationship with, will have to be approved by our office. And the biggest piece there is to remember that if it's an entity that will be carrying out a major part of your award, they are required to be a subrecipient, regardless of the vehicle in which your entity uses to make that relationship. And if they are doing something that is more ancillary, then they may fall into the category of procurement. So again, a lot of nuances, and I'm sorry I can't just give like a straight answer, but I would definitely encourage to review that financial guide. And then should you be selected for funding, absolutely reach out to us after that point and we will provide additional guidance.
Great, thank you, Asia. Okay, next question for the system of internal controls.
I just wanted, I'm sorry, Allison, I just wanted
yes.
to go back for 1 second to include that the OJP grant applicant resource guide is the best resource for subrecipients and subawards.
Great, thank you so much, Brooke. Okay, so next question for the system of internal controls questionnaire, can applicants submit one that is less than 1 year old?
I am not familiar actually with that specific question. So that would be a question that would have to be directed to our resource center.
Okay.
Was that dropped in the chat for all questions going
Yes.
forward for today?
It's just going here now, right? So the OJP Response Center, yeah.
Yes, thank you.
So there was a attendee named Suzanne who asked this question. Please ask this question to the OJP Response Center. That contact information is listed in the chat right now.
Yes, and I just wanted to add that any questions that are not able to be addressed today can be directed to our OJP Response Center at any time in order to have your questions answered.
Okay, next question for mental health partners for applying mental health courts. Do the mental health providers that are going to be part of the mental health court team need to be contracted or binded by MOUs? I think this is somewhat of a question you already answered, but probably good to repeat for that. So yeah.
Yes, so I just wanted to go back and reference the requirements that are listed within the MOU, in which mental health partners are required to be listed in terms of key roles. And I apologize, I am frozen.
Oh, I can hear you, and you don't look frozen, but.
Okay, if you don't mind, if Asia or someone from budget can provide an additional response regarding the MOU, I'm just going to clear something real quick.
I can actually ask another, I could say, I could ask another question and come back to you on that one, Brooke. And the next one is going to be for programs. So, so there's a question about whether grant funds can be used to hire or contract an accountant or a grant manager for financial administration of the grant.
Thank you, Allison. I think that's a wonderful question, and that is definitely an allowable use. Typically, we allow up to 10% of a total project cost for administrative purposes. Again, we definitely would have to see that within the budget. It'd have to go through the approval process to ensure allowability, justification, all of that. So I would just encourage, if that is something you're going to do, to ensure that you have a robust narrative in the web-based budget and just grants to ensure you can make that nexus and show the need of why you may need that individual. But that is definitely a possible allowable use.
Great, thank you. How's it looking on your end now, Brooke? Or
Aja, do you mind responding regarding the requirements for the MOU as well?
Sure. Allison, if you wouldn't mind reiterating the question for me, please, just to make sure I'm answering it appropriately.
Sure. It was a question on whether, if you have, for example, a mental health court and you have behavioral health providers, do they all have to be, do all the contracted ones have to have an MOU completed?
Thank you. So I think the best way to answer that, and again, there may be some additional clarification needed depending on each individual scenario should you be selected for funding. But typically, if you're going to quote unquote contract, or it may be a subaward depending how they're carrying out activities, then we would look for an MOU with that partner. Again, I think it's really going to depend on the activities in which they're providing and how it applies to your project. So I would like to follow up on that more individually, like we are on some of the other questions. And I would just encourage you again to go through the DOJ financial guide. And unfortunately, some of these questions are really dependent on what that application looks like when it comes to us.
Sure, thank you.
Thank you. And I think we have time for probably another 2 or 3 questions, and then we will need to wrap up. So Allison, if you don't mind combing through and just maybe asking some questions that have not already been asked, that would be great.
Allison, I have a couple of questions to elevate because I've answered several questions that were kind of in the same vein. So there's a couple of questions that have come through about the planning phase of the grant, and two different types of questions. One is, even if I have an existing program, do I have to go through a planning phase for the grant? And the answer is yes. The planning and implementation guide needs to be developed for each grantee, regardless of if you have an existing program or not. It is possible to spend less than 12 months during the planning phase, and you would work that out with your training and technical assistance provider to make sure that you have everything in place to be able to implement or, hopefully expand the program that you're currently working on.
Thank you, Sarah. Allison, are there any other questions? We have time for 1 or 2 more.
Sure, Sarah, did you have anything else, or I think that was it, probably. There's a question. Yes, 1 second. Sorry. There's a question. They're saying, apologies if this was asked. I don't think it was, but are there any rules regarding medical cannabis? We haven't seen any language. So I guess that means use of medical cannabis by participants, or yeah.
I am not certain on that response. However, because these are federal grant monies, and marijuana has not been decriminalized at a federal level, I'm not 100% certain that that would be allowable. However, I would encourage you to reach out to the OJP Response Center, and they would absolutely be able to provide you with a more specific response to that. And in case that contact information has gotten lost in the chat, the OJP Response Center email address is grants@ojp.gov. at ncjrs.gov. They also have a toll-free phone number, which is 1-800-851-3420. And their TTY line for hearing impaired only is 301-240-6310. Please keep in mind that their hours of operation are Monday through Friday from 10 a.m. to 6 p.m. Eastern Standard Time. But they've been really excellent at fielding all of these incredible questions. I just want to go ahead and wrap things up. If there were any last minute, was there any last question, Allison, that you wanted to
Sure.
get to?
Yeah, what about this one? Where do we find a list of exclusions for spending? Specifically, can a vehicle be purchased that would be used for clinician response in combination with law enforcement officers? So this is a common transportation, yeah. So I know in the DOJ financial guide, there are allowable expenses, right? Listed.
Right,
Yes.
and that's where I would suggest
ahead,
you go
Asia.
to the DOJ. I would just say you go to the DOJ financial guide definitely for that. And it again is going to really depend on case by case. If you are going to request that in your application, just ensure you have a robust justification, etc. And then we would kind of review on case by case. But best practice is go to the DOJ financial guide. And Tammy, was there anything else you wanted to add?
Yes, I believe that vehicle purchase is unallowable, but you can lease it or you can rent it.
Good options. And
I'm
then,
sorry.
yes, go ahead, Nikish.
Yeah, I wanted to just piggyback on when they were asking about the medical marijuana.
Mm-hmm.
Right, because it's not federal law of approval, then federal funds cannot be used to purchase. No.
And I think they may have also been asking, can they enroll participants who may be on that as well?
Because they can't supply it to them.
Right.
So
right,
that's a
right.
form of
Yeah.
medication that federal funds cannot be used to supply the purchase. Right.
Great. Thank you very much for that clarification.
Mm-hmm.
And I think there are a lot of other questions, so I think we'll just remind everyone again at this point to please re-ask your questions to the OJP Response Center. It's right at the end of our chat here, all the contact information, and it also will be in the slide deck that you'll receive when the webinar is posted in about a week, and the slide deck is posted. So I just want to say a special thank you to all of our panelists today. We really appreciated learning so much more about this great funding opportunity, and to all of our attendees today. We just strongly encourage you to consider applying for the Justice and Mental Health Collaboration Program Award. Ask your questions to the OJP Response Center for any remaining. And Brooke, I don't know if you wanted to say anything else before we wrap up.
I just want to thank you all for attending today's webinar. We know that applying for federal funding is not an easy process. So we hope that we provided you with a better understanding of what the eligibility requirements are and what the goals and objectives of this program are. Again, if you submitted any questions prior to today, you will be receiving a personalized email response from our OJP Response Center. So thank you again for doing that. We just want to ensure that everyone's questions that were submitted in advance are going to be addressed. With that, I hope that everyone has a wonderful week, and thank you for joining.
Thank you. Take care, everyone.